1 o'clock. Co-Chair Lewallen, as soon as you're ready, go ahead.
Okay, welcome everybody to the MLAC Subcommittee for Average Weekly Wage. I appreciate you all being here. I will kick it over. I'm Stacy Lewallen, co-chair from the management side. We also have Scott Strickland with us from the labor representative. We are your co-chairs. Happy to turn it back over to Terry to review our agenda and get us started.
Okay, we have a policy discussion today, and we actually have 2 proposals. So we can go ahead and get started with that, co-chairs, if you're ready. Okay.
I think that's perfect.
Okay, we have one of the proposals actually in the room with us, so why don't we get started with who we have in the room? Kristen Adams from AGC is here, and then we can have Odalius from ASME after that. Okay, so co-chair, I will hand it over to AGC.
Fantastic, thank you.
Thanks, Terry. So this, I've talked quite a bit with other folks in the business community, and particularly Paloma Sparks with OBI and I have been chatting about sort of, after coming out of this, what all the information that's been reviewed so far from the subcommittee, what made sense from our perspective. And so we would propose looking at time loss benefits of 70% of the average weekly wage for some workers based on lower wages, and then retaining the 66 2/3 for workers at higher wages. And looking at other states, that seems to be sort of along the lines, particularly making sure we're looking at the numbers based on pre-tax versus post-tax numbers, and particularly looking at Washington, our nearest neighbor. So it allows for more benefit for employees who are lower wage workers, while trying to avoid a situation where there's perhaps more compensation when folks are not on, or when folks are on TTD versus not. And so, but partially, I think what we'll need to see from this and any other proposals is what NCCI comes back with on what the impact is to the system. Obviously not something that we can figure out without their expert opinion. So we would probably caveat it with that, but that would be the proposal that we think would make sense based on what we've looked at, particularly looking at other states. So, and I don't know if Paloma's on, if she has anything she wants to add, but.
I do not see her.
Okay.
Okay, perfect. Thank you for that presentation and submission of the proposal. Are there any questions or comments for Kirsten or Maggie at this time?
We have a question in the room.
Okay, great.
Thank you. Matt here, Matt West, Workers' Comp Division Administrator. Just Terry and I are actually meeting with Todd from NCCI after this meeting to ask for some analysis on the different proposals. So I just want to make sure that we have it clear. So when we say 70% for low wage workers, what would be the threshold or the definition of what, like, the low wage worker?
We didn't have a set one that we were looking at for that, so I don't know if there's one that's sort of already used in other places, or if that's something you want us to try and get to you as quickly as we can.
Yeah, I mean, they're gonna want to know, like, what either the income, like, based on the, like, state's average weekly wage, is it that, or is it lower than that, or, and then, so if we can get that, because that'll be a question that Todd will want to know, like, where's that cutoff for the analysis to know the impact. And then would it be because we've seen a lot of proposals floating around, so would it be like, if you make this amount or lower, it's your TTD rate would be 70%, and then if you make this amount or higher, it would be 66 2/3. So not like the tiered, because some of the proposals is everybody's wages up to a certain amount at a certain percentage, and then anything above that is 66 2/3. So that's not this, correct?
No, we were thinking of the two, and we know that inevitably will create a cliff of some sort, of benefit cliff. But we were trying to think of a way to avoid that without getting too complicated, and we just couldn't. We figured trying to stay with some simplicity for ease of calculation and ease of folks knowing how much they should be expecting.
Yeah, no, that's totally fair. So I'll make sure when we talk to Todd at NCCI, we have it clear. So yeah, if you can just, when you can, if you don't have it today, it's okay, but like what that threshold would be for the analysis. Perfect. Thank you.
Hey, Kirsten, did I see where, in one of the proposals sent over that it was referencing the average weekly wage? Just kind of that state average weekly wage, was that intended to be the threshold? Or was I looking at something different?
That was not something we'd included in R1 in terms of a threshold, but, and I mean, we
Okay.
had a weekly wage in terms of like looking at the benefit percentage, but not in terms of a calculation for the threshold.
Okay, got it. Thank you. Mike, do you have a question or comment? Oh, okay, perfect. Thank you. Any other questions or comments from the group? Okay, hearing none. Terry, kicking it back to you.
Okay, we have Odalis from AFSCME. And she is the next proposal. I saw her on her. I know she's, oh,
I'm here. Here she is. Hi,
she is.
Elise.
Okay.
Hello, good afternoon. Odalis, she, her, ella with Oregon AFSCME. And thank you, Kirsten, for presenting your proposal. I sympathize with the complexity and trying to figure out a good solution. I have been wrestling for months on end, and there's no perfect solution. So welcome to the party. Our proposal, the labor proposal that we sent over, and we also requested an NCCI analysis, would be to have workers have their wage replaced at 80% up to 75% of the state's average weekly wage. And then any wages above 75% of the state's average weekly wage to be replaced at 66 2/3 while maintaining the cap and the floor the same. It would just create like the other proposal, kind of two different formulas that would be added together to get to the total benefit for the worker.
Great, thanks, Elise. Are there any questions or comments for Elise?
I have a question.
Please proceed.
Yes, Elise, Matt, again, not to, but so similar question, just so we can make sure we're clear on our ask to NCCI. So would this be all workers' wages would be calculated, the TT would be calculated up to 75% of the state's average weekly wage for every worker would be calculated 80%. And then if I make more than that, then my wages above and beyond would be at 66 2/3? Or
That's
is it a, if you make less than 75%, you get it, yours would be calculated 80%. If you make more, your entire wage would be calculated at 66. So same question.
Yeah,
Yes.
the first thing that you said.
The first, so all workers' wages at 80%, and then any wages above that at 66. Perfect, okay.
Yes.
Just want to make sure we have the ask correct.
Yes, thank you.
Okay.
Okay, any other questions or comments? Yes, Mike.
I just wanted to very strongly underscore support for AFSCME's proposal in terms of the numbers there. And looking at what was proposed earlier, I don't think that comes close to closing the gap. I think the obvious point of the workers' comp program is to compensate workers for the time that they're not able to be at work. I think that there's trade-offs that workers have abided, like a lack of cause of action, and to not be willing to close that gap further and get closer to the AFSCME plan, I think is frankly imperiling the principles behind the Mahonia Hall Agreement generally.
Okay, thank you for your comment, Mike. Giovanna?
Yes, thank you. Appreciate everyone's comments here today and all their work on this committee so far. You know, we've been following it and all the iterations, and we really appreciate the changes that are made into this that both aim to have some consistency for purposes of practitioners and workers being able to calculate it, and insurers and all the stakeholders. We don't want to not be able to tell what people should be making. So I appreciate that. And I think that this proposal also does a really good job of preventing that step off issue where someone could get a raise and then suddenly they actually make less than they would have made before the raise. So I think the kind of tiered approach to it makes a lot of sense to prevent that step off issue there. So, speaking on behalf of the claimant's attorney and for OTLA, we certainly support this tiered approach that has been brought forward. We do have concerns about just increasing it 80 to 70% across the board. Like I said, the drop off where it shifts could create some unintended consequences. And it's just really not a huge increase to the workers. I'm not a mathematician, but I just did like a 50,000. Like if someone made 50,000 a year, how much are they making now versus how much they're making under a 70% rule? And I got like a $38 a week difference. And I don't think that's the sort of change that would actually provide some meaningful change, especially to the low income workers. So it's just not a big enough increase to address the need. So thank you.
Thank you. Willis?
Also just wanted to give our support behind this tiered approach that AFSCME is bringing forward. I was just looking up the average wage of our worker at the Oregon School Employees Association, and we're looking at about $40,000 a year as our average wage. And just doing some back of the napkin math, this approach would really be a beneficial jump for our workers as opposed to the current way that things are operating and the 70% approach. So just wanted to give voice to that.
Okay, thank you. Lamar?
Yeah, thank you so much. And yeah, Odalis, thanks for proposing this and coming up with the math behind it too. Just, a little bit more coming from AFSCME's perspective on this. As we've stated before, I think our focus is wanting to make sure that low-income workers, the folks that utilize workers' comp the most, and struggle to live with their wages in Oregon are our main concern. We know from the data that's been displayed that even with the state's average weekly wage as it stands right now, it's not even really enough to afford many parts in Oregon to live in. And so, I'm not trying to have MLAC or this process kind of fix the larger issue that we have with workers' wages, but every bit that we can do to get a little bit closer to making sure that folks are able to sustain themselves and their dependents, I think is meeting the letter of the law for why workers' compensation was constructed in the way that it was. In addition to that, like I also want to say, I know that there were conversations about dependence earlier. I think that is an important conversation and we should continue to have it. But I think the solution that Odalis brought is at least a step in the right direction. And I do want to have a more robust conversation about dependence, but later, because I think it complicates. I think that complicates the issue a ton, and I want to make sure that we're taking feedback from the folks at this table and then our members as well. But I do like this policy. Just from coming from AFSCME, we have behavioral health workers that make between 40,000 and 50,000, but we also have like correction officers and folks in SACU that may make more or on the higher end of this. And so I think this is for us it is a compromised policy because not even all of our members would benefit from this if they were injured. But like I said again, I think going back to the core of why workers' comp exists and making sure that they're especially low income folks are able to sustain themselves. I think for that reason we're supportive of that and appreciate Odalis working on this for us.
Great, thank you. Kirsten, I believe you have your hand up.
Yeah, I just wanted to respond to a couple of things. First, ours, kind of our proposal, what we were looking at is what we believe the background for this benefit is, and that is to look at getting injured workers to as close as we can to their, to what they were making before the injury. And so I think part of the comments I'm hearing seem to be a broader focus of wage issues in Oregon, generally speaking, and how much people are making generally. And I think that's a much broader conversation. I'm very sympathetic to the fact that that is definitely an issue that Oregonians face, and is a broader policy thing. But I think at this point, what we're trying to look at is what is the amount necessary to bring people to as close as we can get to their pre-injury income levels. And so I think that, at least from our perspective, is the focus we should be looking at. And that was, and maybe 70 isn't the right number, but that I think is, when you look at 80%, that is going to be probably more than most. I mean, if you look at, most people are gonna be paying more than 20% in taxes unless they fall into the lower wage, in a significantly lower wage bracket. So, I think from our perspective, the view is, how do we look at what the taxable rate is and what we need to be doing to get folks as close to compensating for that. And that is my understanding of what the 66 2/3 came from in the first place, was trying to get at that, given that we're not taxed. And looking at the state, the state disability, TTD rates, the excellent chart that was put together, thank you to WCD for doing that. But all the places where it's 80%, those are post-tax dollars. And so I think just kind of looking at what other states are doing, and I know, it's, no state is the same when it comes to workers' comp, so I'm aware of that, but I think looking at some of those numbers, we should be aware of kind of what the right number is for tax. And I understand that there are broader income issues and broader wage issues, but I don't think that that's something we can just solve in this policy. So I just want to make that.
Thanks, Kirsten. Looks like Scott has his hand up, and then Evo will follow Scott.
Thank you. Yeah, I wanted to thank all the stakeholders for bringing the two proposals forward. I think this is going to be really helpful in kind of driving the discussion moving forward so that we can sort of orient some of the data and other information around it. I want to say at first glance, it seems to me like the presentation brought forth from AFSCME with the 80% with the kind of tiered bucket model addresses a lot of the concerns that have been raised relating to striking that balance where lower income workers are not taking a kind of huge deduction in what their normal net sort of take home would be. I think getting to Kirsten's point, I do think actually the 80%, if you look at the numbers in the tables from WCD, does accomplish that without having a net increase in take home pay, especially if it's targeted towards the low income, which the AFSCME proposal seems to be. I don't feel that the 70% at first glance, and I'd love to see the tables worked up and updated from WCD and all the great work that they've done thus far. I would think that would be relatively easy to do with the crack team that they have. But would love to see that. But the 70% doesn't, at least at first glance, seem to address the fact that I know that there was a 10 to 19%, if memory serves, depending on dependents, for the lower income folks, loss if they were filing for work comp compared to their normal take home, given the tax brackets. And I think given the data that we had on concerns about housing costs and the inability of work comp at the current rates to cover anywhere near the median housing costs, and then not obviously including things like healthcare, additional healthcare for the family and dependents, or childcare, or other kind of exploding costs that folks are facing. I don't know that 3.5%, which I understand for the take home would maybe net 5 for those folks, would be enough to kind of address those concerns that we raised. But again, would love to see more from WCD and to get back the NCCI analysis. The one thing that I would request, I think in an initial email that we'd received, that there was a little more clarity with the proposal from Kirsten and Paloma, but if we could get those numbers so that we could get the NCCI analysis on that, I think that would be really helpful. So again, thank you to everyone for bringing this forward. I think it's really helpful in kind of framing the discussion to advance.
Thank you. Evo.
Yeah, thank you, Co-Chair. Yeah, I want to echo Scott in saying it'd be great to have more data, and I want to wait for NCCI to do some analysis, sort of impact on loss cost rates, and then on our pure premium rates before kind of having a more informed opinion. I do want to make a plug though for implementation date of whatever is considered. And I can only speak from the perspective of the insurer. Self-insured entities might have a whole different kind of way of thinking about implementation date and how to budget for any eventual increase. Since I see Will is on here, right? Yes, SAFE insures most of the school districts, but we don't insure the largest school districts in Oregon, right? Portland, Salem, Cayuga, et cetera. They're all self-insured. They pay for any increase out of their own budgets. So their implementation might look different from an insurer's perspective, though. NCCI calculates, if I understand it correctly, around August or FAL's loss cost rates on which we base all insurance premiums. File them in August of any given year, then the insurer, and that's us and all the other 300 private insurers in Oregon that offer work comp insurance, file in September-ish with the department, and they go into effect 1/1 of the following year, which is why I would say should a bill be passed eventually in March of next year, to wait with an implementation date until 1/1 of 2027. To make it easier for the insurer to adjust premiums and rates for the insured entities and the policyholders. So otherwise, any increase, I understand, will flow right through straight to the mod and impact policyholders much bigger than if it is done through premiums. So that's my plug for the implementation date. Again, I can't talk for the self-insured entities, so the large school districts, or since Mike is on here for UFCW, some of the large grocers might have a different sense of what, but look to them to kind of speak up.
Great, thanks, Evo. Any other questions or comments?
Co-Chair, Administrator West has a question.
Oh, great.
Thank you. Yeah, I just want to make a comment to Co-Chair Strickland's request. We'll go ahead and update, we can provide the chart for the two scenarios, the tax chart that we provided and what the wages would look like. So our research team will work on that. And then to Evo's point, the NCCI would, we don't know this right now, but they'll want like an assumed implementation date as part of their calculation. So I don't know if we don't have that discussion, or we could just say assume a 1/1/27 for now. And then if that changes as the discussion goes on, we could tweak that. But that is one of the questions that NCCI asked.
And Co-Chair Lewallen, Raphael wasn't able to make today's meeting. I know that Kelly is on the call, but he's the one that's making us all these wonderful data charts with all the information, and he apologized for not being here today.
Oh, that's great. Appreciate that. I appreciate all the work he's done helping us along the way. Okay. Call for any other questions or comments. Not seeing any hands in the gallery. Anyone else in the room?
Actually, we do have one more comment in the
Perfect.
room.
Great.
Caitlin?
Hi, yeah, sorry, Caitlin Brightbaugh, Small Business Ombudsman's Office. Thank you, Evo, for pointing out the correlation between the time frames and helping with NCCI and making sure that the policyholders are kind of hit at a more fair rate. I just also want to add, somebody earlier brought up Mahonia Hall and the spirit of what that was. I also just want to add that part of that was fairness on both sides, meaning employers are not going to be overcharged and workers still get benefits that are appropriate for them. And so I just want to kind of reiterate that when we're upping these time loss benefits, that's obviously going to create a higher claims cost, which then is going to cost extra premium on small businesses within Oregon, all businesses within Oregon, but our smaller businesses, which is a large part of our economy, could be affected maybe a little bit more than we think with these raising costs. So I just wanted to point that out, make sure that was kind of understood, that there's checks and balances there.
Thank you, Caitlin. Mike?
Yeah, thank you very much. Wasn't my intention to get into any kind of mission creep there, but I think the I think the lead was kind of buried in that when the question of general affordability and general salary enters this conversation, it's not just because we're trying to insert other policy issues into the discussion. I think that it's a vital part of the discussion to recognize that we do have a significant amount of people in the workforce who are living very marginally, who don't have a lot of savings, to whom, $40, $50 may be the difference between making rent or having to eat cat food for dinner. And the idea that we could not, the idea that we would be casual about not closing the gap between what they had expected to earn in a particular week versus what they're actually going to be taking home is going to be, in many cases, the difference between themselves lugging them back to work before they should be at work, whether that's because they are still infectious from a disease or whether that's because their body hasn't healed yet. And it's that concern that that leads me to worry about the underlying principles here. Not trying to spin this conversation into something about minimum wage or economic justice generally, but nevertheless, I think those elements do have a bearing on what we're talking about.
Thank you, Mike. Paloma? Paloma, are you able to?
Sorry.
Okay, perfect. I didn't know if your audio is working. Thank you.
Yeah. I feel like we've been throwing around a lot of numbers that aren't necessarily related to the average weekly wage. So 80% of average weekly wage annually is 59,000, give or take a couple dollars. The average weekly wage without the 80% is about 74,000. So we're not talking about 40,000. I just wanted to sort of have some concerns about the idea of how we're talking about these numbers, and I just wanted to put that on the record. Thanks.
Thanks, Paloma. Elaine?
Yes. Hi, co-chair. Elaine Schooler for Safe Corporation. I was just watching the prior meeting. I wasn't present for it, so to catch myself up, viewed it, and supplemental disability was raised as a consideration and how any changes may impact that. I was curious if the impact analysis that will be done by WCD and also by NCCI would take that into consideration for the different proposals, as well as other benefits that are tied to 66 2/3 of wages, such as permanent total disability benefits, to consider situations of where a worker who's on temporary disability has one rate. If they were to transition to permanent total disability, then would be subject to a different rate. And keeping that in mind too, as numbers are calculated and impacts are evaluated.
Thanks. And yeah, great point about the supplemental disability piece or other income components that workers may have access to, may or may not have access to. I think, Terry, if we could incorporate that into any of the calculations as applicable, that would be great. And to understand what that looks like. I do think that some of that is policy by policy basis, so we might not be able to have some exact numbers, but perhaps we have a scenario where if they're able to have it, this is what that look like, and if they're not, then this is what that look like. And it may be a situation like that. It look like maybe Director West has a comment, maybe. I'm reading the room a little bit.
Work on my poker face. So good point by Elaine. We can certainly add that to our analysis. Our understanding 705 didn't touch any of that, was strictly, because it's 66 2/3 is used to calculate other benefits, as Elaine pointed out. So the bill is written, 705 was strictly related to temporary total disability calculation, so we can do a broader analysis of changing that 66 2/3 in the other benefit areas as well to share that.
And I think it would be helpful, more of how I'm thinking about it is not necessarily to have it as part of the calculation, but just so that we understand the situations that employees, their income is in, as we're looking at where we think this number should be and what that looks like. I think understanding if there are other avenues for employers to have additional compensation through the various systems, if that is possible, to understand what that is, because obviously then that could change what the worker compensation impact would look like as a total comp piece. Does that make sense? And Elaine, is that kind of where you were going as well?
Yes, just to have a broader view, because there are other areas that utilize that same 66 2/3. And so when we think of the whole system, those are considerations that the committee may want to keep in mind going forward as decisions are being made and impacts are being analyzed.
Great.
Thank you.
Thank you. I am curious. We've heard a couple proposals, which thank you again, they're great proposals, and both center around creating a two-tier system of some sort, whatever that looks like. I would love to just confirm with the insurers and others that would be implementing this calculation into their daily work and daily processes. Is this doable from the administrative aspect of it? Now, I want to understand what we're throwing at folks to manage here.
Which particular part are you thinking?
Just having two tiers. So again, numbers aside, whether it's 70 or 80 or whatever it is, but just having two different calculation methods to calculate someone's leave. Are the systems set up to be able to easily pivot to be able to handle that?
So we've had some preliminary internal conversations about that particular issue ever since 705 and some of the iterations there. It's also why a 1/1/27 implementation date would make a lot of sense. You would have to, it's basically an IT issue more than any other thing, but still IT needs to kind of be able to calculate or write the program so that once you plug in, it does the calculation automatically, however that is.
Okay, so we'd have some system updates and upgrades that would be needed before we could manage this process. Okay.
Yep.
Thank you, Eva. Appreciate the insight. Are there any other questions or comments from folks? I guess, it looks like Scott has a comment.
Yeah, I just wanted to thank the ombuds for small business comment. I think that's very important, and understanding that perspective and that context. To contextualize it further, I do want to make the point that, as we're talking about, and again, dependent on what the NCCI analysis comes back at, but I know that the -2 analysis was, I think they were talking, 2 to 4%, depending, that we've seen, I believe, nothing but straight reductions in work comp premium rates for over a decade, and that Oregon is now one of the lowest cost states as well. So I think in the discussion of sort of the context of that, especially when there has been such tremendous inflation, a part of that I know is attributable to Oregon's workplaces being safer, which is great, and work that we should all, I think, congratulate folks on and continue in. But I think in kind of linking that back to the understanding of the Mahoning Hall bargain is we need to commit to making those workplaces safer, continue that work, but also recognize that the pendulum doesn't just swing one way. And that if folks are receiving substantially less to the point of not being able to afford to either file or continue claims, that is not in keeping with the bargain, and that causes a number of problems that I feel, we've seen some data and we've heard some comments today on that as well. But just wanted to kind of, again, as Stacy's mentioned, be mindful of the context of these discussions and sort of what else we're touching on and the historical path that got us to this point.
Thanks, Scott. Evo?
Yeah, I just want to maybe clarify a couple of things here, Scott, and thank you. Yes, work comp rates in Oregon have been going down, but that's an average number when we talk about that trend. Certain class codes have been trending up in actually quite a bit. So it's an average number that you're looking at. So the increases are for certain employers higher than the lowering for others in other areas. So that's one. I believe Oregon is now 10th lowest in the nation, if you want to think of it that way, which is remarkable because we also have some of the really better benefits than many other states. We used to be lower than that right after Mahonia, so that's been an increase over the last 20, 30 years. So I just wanted to kind of point that out. Thank you.
Thanks, Evo. I would also like to point out from the employer side that there are a lot of costs that have been incurred by employers to help make workplaces safer. And that while the workers have definitely had an effort in bringing in those results, and we're happy to see that the workers are going home safer every night. That's the whole goal of this, is for no one to be injured. But I think it also needs to be noted that there's been a significant investment from employers and industry to make things safer, and that has a significant cost. And so as we start to look at increasing the cost of claims and the impacts of the work that we're talking today, that absolutely will be significant to employers. And depending upon some of these smaller companies, that could then impact what's available for safety programs and safety resources. So just something to think about. One thing that I've been advocating this entire time is we need to collaborate and come up with a good compromise. I don't think if someone leaves this room happy, then it means we probably didn't come up with the best solution. So I would say that it needs to be a collaborative approach that we see as an improvement, but no one's going to hopefully leave 100% jumping up and down for joy, because it is there's arguments on both sides, and very compelling arguments on both sides to support both the worker view and the employer view. And so I just think we need to continue going through this work with that in mind. Looks like Paloma has her hand up, and then followed by Scott.
Thanks. Yeah, I just want to say, I mean, I think we've been throwing around a lot of things about Mahonia Hall agreements. I mean, so for the past 7 years that I've been involved in these conversations, I will say, as an employer representative who has participated in several subcommittee processes and negotiations at the legislature, a lot that was really important to employers in Mahonia Hall has been chipped away at quite significantly over the years. And, you know, this feels like another move in that direction. Not to say that we're not happy to have a conversation, but to act as if Mahonia Hall agreements have been just protected from any changes is just factually inaccurate, and has not been our experience as we've sat in these meetings and these processes. So thanks.
Thanks, Scott.
Yeah, and I want to thank Paloma for that comment. I think there has been a substantial chipping away of Mahonia Hall, and I think that is also on the labor side when it comes to investments in OSHA. which was sort of the cornerstone of the agreement, and the whole context behind that and the worker safety committees was, to Stacy's point, the investment in safety, because that's really the only way that we can have this not be a zero-sum game. And I think that I'm sympathetic to the cost concerns. I worked in a small business legal clinic. I understand a lot of the costs and the difficulty in starting a small business in particular, and then maintaining that and growing it. But I do want to say, once the injuries occurred, this is a zero-sum game. And so if we're talking about increasing the payment that is going to the worker, that's not a new cost that comes out of nowhere, that is not currently being absorbed culturally. That cost is currently being paid by the worker and their family in terms of finding debt financing for things, in taking additional jobs, in foregoing other things. That cost is accrued and is being attributed, but to the worker currently. So if they're receiving a net loss in terms of their wage, they're finding a way to cover that cost, and that cost is being applied to them. And I think that's something that we need to keep, just because we don't keep the numbers on that, and we don't tabulate that data, and we don't collect that data. I think that part of that is that there's a cultural choice about that, that's problematic. But again, I think once the injuries occurred, it's a zero-sum game. We're not adding new costs. We're just having a discussion and debate on how those costs that are occurring should be attributed. And I think that there's, obviously a couple proposals in front of us saying, we should attribute them different ways than how we're currently agreeing to attribute them. And that will be a cost shift. And that cost shift may be problematic. It may be problematic in one way or another, but it is a cost shift. It's not a brand new cost out of nowhere. And I think that's kind of part of the contextualization of this discussion that's important. And I know we ran into this with the 4-hour bill. I think it was a couple sessions ago, where there was a discussion about, it'll cost $9 million or something. It's like, well, it's currently costing $9 million. Workers are just paying that. And I think that's part of the point of the discussion. So I really appreciate the stakeholder input. And I feel like this is another one of those good meetings where we're getting a lot of, really good impassioned discussion that I think highlights all of the different perspectives that we have, that we can be mindful of when we find a way to move forward. And that's one of the reasons why I'm so excited to have both of these proposals out, is because we have that to kind of, we can orient and apply all of the data and the discussions of policy to the proposals in front of us. So I just, again, want to thank everybody for coming forward and for participating. I think this is robust and productive discussion so far.
Hey, thanks, Scott. I think Kirsten has her hand up in the room.
Yeah, thanks, Butcher. Couple different things that I wanted to respond to. So I guess the first thing I want to say is, I hope that it's understood by all folks around the table that the management community is coming to the table to have a conversation about this. We're not saying stick at 66 2/3 period. We're coming to have a conversation about how to find the right solution. So we're, any insinuation that we just want to keep things status quo, I think, is not accurate. The other thing I want to say, backing up on what Stacy was saying about safety costs, obviously in the construction industry, safety is incredibly important. AGC very much puts its money where its mouth is on this issue. We have a whole safety team that tours the state. And this is something that, construction companies do care deeply about. And to Stacy's point, put a lot of financial backing into, and it's the right thing to do. It's what they want to do to keep their folks safe. But to the point of costs that are not captured in the system, that's very much one of those costs that are not captured here. And I think another piece, there's been a lot of discussion about inflation and the impact that has on Oregonians and their day-to-day pocketbooks and their day-to-day activities and living and cost of living. And I think we all feel that. But that same inflation that's impacting how Oregonians feel in their personal lives is very much impacting business as well. So those costs that are driving up the cost of day-to-day living are the same, to Caitlin's point, the same costs that businesses are accruing on their own side. And so it's not, looking to spend as little as possible, as looking at, okay, I need to stay in business so I can continue to employ everyone. And so at what point does that, does that shift? And I'm not saying that a couple points on average weekly wage is what's gonna make the difference, but when you look at the stacking of different expenses and inflation that's coming at the business community in Oregon, that really starts to come into play. And so we're also trying to be, mindful, as Paloma was saying, as we've said, to the business climate in Oregon and the different pressures that are on our businesses as well, when we're trying to come forward with, something that we're trying to just find that what could be the right solution. But, there are other instances and other things coming into the business side of things, just like people are experiencing in their personal lives. So just wanted to flag this as well.
Thanks, Kirsten. And I don't see any other hands at the moment. Any other comments, questions? Give a second in case something comes up for anyone.
Nothing in the room, Co-Chair.
Okay. Okay, so then my next question to the group, as we heard Terry, Mr. Wester getting ready to meet with NCCI to figure out some costs and what this looks like, for the two proposals we have. Are there any other proposals or any other variations that we would like to see numbers ran through NCCI? I think, Scott, hopefully I'm speaking for both of us, but I think our goal is to have the data and understand the cost impacts for the next meeting. And so it would be helpful if there's anything else that we want to just run through an eyeball. It would be helpful to know that now so that the work can be done before our next meeting. One thing that I thought about in the spirit of looking at how do we all come to the table together, I would be curious to know what the numbers look like at 75% of both using the 70% state average weekly wage, but then also whatever metric that Kirsten defines for the proposal that she has. So looking at what 75% would be for either of those as well. Are there any other thoughts? And again, that's purely to grab data points so we can see a full measure. Definitely not insinuating that should be the number, but just trying to understand what this looks like so we can make an informed decision.
Can I, sorry,
Yeah,
it cut out a little
please.
bit, so I just want to make sure I heard the right thing. Did you say 75 at 70% of the state's average weekly wage, or?
Yeah, so in lieu of 80, what does 75% look like? Yeah, so taking your same proposal, Elise, but what is it instead of 80%? What is it at 75%? And then same for Kirsten's, instead of 70%, what is it for 75%?
Okay, I just, for the record, our proposal would not go to the state's average weekly wage. It would be
70%, right?
It would be 75%.
Or 75%,
Yeah,
yes.
so, okay.
Apologies, yeah,
No,
got my numbers
thank you.
crossed.
Yeah.
Thank you.
Lots of numbers, so I want to make sure that.
Yes, same threshold that you're using, just 75 instead of 80. And then for Kirsten, same threshold instead of 70, what, 75?
Thank you.
Any other thoughts or ideas on how we could tackle this with regards to looking at data? Looks like Keith has his hand up.
Hi, Keith Semple, OTLA. I was thinking about, I think we've already kind of slightly gotten at this, but whether somebody smarter than myself in math can figure out where the tipping point is, where it's as close to 100% of the average take home, pre-injury that you can get. I mean, within a range of a margin of error. I don't know how to do that math, but I wonder if there's a way to kind of get a little bit closer in terms of, okay, where is that tipping point? Because I have no idea how you calculate that. But I'm sure that there's a model that, someone could do that math.
Yeah, I know I've done some back the napkin math, just looking at it, and the difficult part that we're running into is everyone has a different tax situation. They could have a spouse that is either a high wage earner or low wage earner. And so trying to figure out what that looks like is very difficult because you could have someone that may have a 10% total tax bill or someone that may have a 45% tax bill once you take into account FICA and some of the other local taxes and such that we all see. So I agree, Keith, that would be amazing. I personally have not figured out what that looks like. I've definitely ran some scenarios, and you can see where even right now with the way the system currently is set, if someone is at the higher end of a tax table, the system right now is pretty close. But then again, it runs into, if they're in a lower tax bracket, then that's where that disparity begins to creep in. And so, yeah, I feel like that's the elephant in the room for sure, is that nobody is in the same situation. And that's the piece where, back to my earlier comment, I really do feel like we're going to have to come to a place where we feel is reasonable. But again, I feel like if we come to a spot where one group feels 100% good about it, we probably didn't land at the right spot, is my impression, because it is multifaceted, and there are just so many different factors involved in this where it's very difficult. Elise.
Yeah, I really appreciate you voicing that, and I think that's why we moved from, well, we moved a lot from the original proposal already. But I think that's why we settled on like 75% of the state's average weekly wage, not the state average weekly wage, because we wanted to make sure that like the playing around with the numbers, and I'm not going to show you my spreadsheet because it's horrendous. Um, uh, we believe that kind of with the 80% at the 75% of the state average weekly wage does really get close to closing that gap. And keeping in mind and making sure that they're as close as to their actual tax bracket. And I think that is about $50,000 a year. Those folks do end up getting taxed close to about like 20%. So that's kind of like the reasoning behind our proposal that we presented today.
Yeah, and agree that if we knew that it was a single party and taxed at the same rate, then that'd absolutely be an easy solve. But unfortunately, there's a lot of individual factors in everyone's situation. So, but I appreciate the effort that went into that. I think both you and Kirsten did a great job in trying to come up with a reasonable approach and something that at least spurred discussion and got us moving in the right direction. So it's great. Thank you. Any other comments or questions or ideas for calculation while we have NCCI's attention here in a little bit? Looks like Scott has a comment.
I just wanted to reiterate Stacy's just comment now of thank you to the stakeholders for bringing this forward and helping drive the discussion. I think this is very helpful.
Okay. Well, I'm never one for carrying on a meeting longer than it needs to go. I'll do one more opportunity if anyone has any other thoughts or questions before we turn loose with the next step of getting some NCCI calculations. Okay, shooting it back to you, Miss Terry. What's next?
All right, well, like Matt said, we're gonna meet with NCCI this afternoon, and then our next meeting is Friday, September 26th.
Okay.
Okay, that is our scheduled last meeting. Hopefully we will be good to go.
Yeah, I have high hopes.
All right.
Anything else you have now that you're here?
Yeah, I would say just a real encouragement to the stakeholders to engage on this and touch base kind of in the interim so that sort of final scheduled meeting, again, whether that ends up being the final meeting or not, but the final scheduled meeting ends up being very productive as well. And I think, stakeholder engagement, both with the co-chairs so that we can kind of help facilitate that, but with each other as well. And I know that you've already been doing a lot of that work already, but just would encourage that. So thank you.
Absolutely. Totally agree.
Thank
Okay.
you.
I'm sorry, Terry missed that.
Oh, I just said thank you, everyone.
Okay. Oh, look, Odalise, you good?
I just had a question about the date we expect in NCCI to be finished with their analysis. If you
He said September 22nd, but we're meeting with him this afternoon, and when I have a better idea, I will let you know. Okay?
Thank you.
Perfect. And yeah, Scott, I don't know if you're opposed to this, but I would welcome Terry to share that data with the entire group as that information is available, so we can everyone can start reviewing and running their own calculations and ideas, and that way we can come prepared and ready to find a solution. Do you agree?
Absolutely. And I know that our friends at WCD do a really good job with the website and posting the materials there sort of as they roll in. So would just say thank you again for that. Please keep that up and encourage stakeholders to keep an eye out there as well. So as the data rolls in and the information and the additional analysis, we can get that posted.
I'd be
Yeah,
happy
that's
to.
great.
And I can also get, as soon as Raphael gets me the updated data, I can post that on the website as well. And I will let everybody know. Okay?
Perfect. Appreciate that.
Okay.
Okay, well, hearing no other comments or seeing no other hands raised, are we ready to say goodbye for the afternoon? Any other questions from you, Terry? Anything you need?
Nothing I
Okay.
need. Thank you.
All right. Thank you all. Have a great afternoon. Appreciate your help.
Thanks.
Bye.
Thank you, everyone.
Thank you.